that I have to pee once I get up there. Well, that's because your parasympathetic has kicked back in, and now you're again able to pee. As far as if you're getting chased by a bear, or if you're calming down after getting chased by a bear and sitting down and doing your meditation, right? This is all normal, okay? These are all normal symptoms that you would expect, right? Everybody comes into a test, their heart's racing, right? You can feel your heart pounding in your neck. You know your blood pressure's up a little bit, right? Absolutely. But when people get medications that affect either the parasympathetic or the sympathetic side, when people get those medications are not often within an appropriate environment, so we get kind of some symptoms, right? So if I was getting chased by a bear, it's totally appropriate for my pupils to get huge, right? Or if I was sitting and reading the paper and relaxing, it's totally appropriate for my pupils to get small, and that accommodation is appropriate. However, when I get a medication that might induce one or the other, the result for both of them is blurred vision. Okay? So that really messes people up when they're thinking, they're like, well, why do they get blurred vision on both sides? Well, that's because of the accommodation just completely being inappropriate for the situation usually. So that's where we're at with that. If you've got a medication that is working against this side, then you'll often get, if it's working against this side, you'll often get dry mouth, you'll often get dry eyes, you'll often have problems with that. If you have a medication that is parasympathetic or sympathetic, you should know what a person's blood pressure and heart rate are, right? Absolutely. Oh, that person was able to get in. So if you're going to give a medication that's going to affect something, you should know what that status is before you go ahead and give it. If I was going to have a medication that was going to drop somebody's blood pressure that's working against the sympathetic side, it's going to drop their heart rate and their blood pressure. That's a big deal, right? So I need to know what the blood pressure and the heart rate are before I give it, and I need to make sure it's safe. Even if I don't have parameters from the doctor to hold something, I can go ahead and hold it and call them and get parameters, okay? So that's something that you want to know about. If I've got a med that, and it's outside of the parameters to give it, and I've got parameters there, then I can hold it and write a note, right? If the provider has provided parameters, right? Yeah, that's totally fine. But if they haven't provided parameters, and my patient's blood pressure is 80/40, and I've got a medication, and their heart rate is 55, I've got a medication that's going to drop both of those. I need to not give that and go ahead and call the physician, get an order to back me up, get some parameters on that order that's in there, and then write my note. But first of all, I got to deal with the safety of that patient. So I got to make sure that they are actually still responsive, right? That they're actually perfusing their brain. So trying to get people to think like a nurse in that way, that's kind of the hardest way to look at medications. Most students are looking at it like, I need to memorize all of this stuff. Well, it's really more important to look at it like a nurse and to use your deductive reasoning, your critical thinking when you're looking at this stuff. As far as the lungs are concerned, if you're giving something that is parasympathetic, oftentimes, or if you're giving something that's anti-adrenergic, which is also anti-sympathetic, we also call that sympatholytic, okay? or an adrenergic antagonist. If you're giving something like that, and sometimes it's these meds that that will block the heart rate and the blood pressure and bring those down. There might be some lung problem, some lung responses with that. You might get bronchospasm. I know in a lot of your, I'm reading a lot of the discussion posts, and people were posting about bronchospasms with beta blockers, right? Anyone? I know that there were several of them. So that's actually why some people just genetically, their receptors in their lungs look similar enough to the receptors in their heart, and the drug can't tell the difference, right? So you can argue it vice versa, but neither here nor there. So that's what's going on there. As far as symptoms, here, if you're going to decrease peristalsis, if you decrease it for a long period of time, what can you get? Constipation, absolutely. Bowel obstructions, right? Yeah, absolutely. If you increase peristalsis in someone,